Welcome to the Minnesota Home Care 2025 in-service. You will have a list of forms that were emailed out to you. The first one should be the directions to complete the in-service packet. Make sure each form is filled out completely and that you sign and date the bottoms of everything that needs to be signed. Read through the directions first and then complete the training. We're going to go over a couple of notes first. If you have a new address or email address, please make a note of it. Also, if you have a new phone number, same with your client. If they have a new address or phone number, make sure we have that on file because we need to keep HHA Exchange up to date. Please watch for our monthly training and reading in your email. This will be more in-depth training than what we do in the packet. Everyone should be doing electronic timesheets if their client is required to have it done. If we haven't already asked you to do them, then your client doesn't require it. Make sure you're filling your time cards out correctly. If you need whiteout to fix it, then you'll have to redo it. Each time card should be original. Make sure you're doing your time in and time out with AMs and PMs. Have every day of the pay period on there. Make sure you are initialing whatever tasks you help with for the day. Make sure you have them in the office the day that they're due, which is every other Monday before 4 p.m. and make sure they're correct. Otherwise, we'll have to ask you to redo them. Make sure you're not doing more than 275 hours total in a month, no matter how many agencies you work for, and no more than 40 hours per week for Minnesota Home Care unless it was otherwise approved, and that's just like on a calendar, Sunday through Saturday. Make sure you're rounding your time card to the nearest 15 minutes. Have your PCA number on there. If you don't have it, let us know. Make sure you're signing in and out every single day. Make sure you call the office to get any overtime approved before you work it. Make sure if your clients are homemaking, respite, in-home supports, or ICLS that you're documenting what you do daily on the back of the timesheet. We do have a new timesheet with the space for notes if you would like some. You can also just document on the back of the ones that you already have, and then when you run out, we can give you the new ones. If you're transporting clients, you must document that on the back of the timesheet as well, and then we must have your current driver's license and insurance cards. For their care plans, make sure you're only marking what is on their care plans on the timesheets. You should have an example time card that comes with their paperwork every year that shows you exactly what you should be marking off. If the client has flex time and you use too many hours and they run out, you do not get more. If you have not yet, make sure you like our Facebook page. We do some contests on there and have all the up-to-date job openings. Make sure if you're sick, you call Minnesota Home Care right away so that we can get you covered. Make sure you're washing your hands good with soap and water. If you do not have soap and water, you can also use sanitizer. We do have some extra sanitizer here at the office if you ever need it. We also have some extra masks and gloves and that kind of stuff. While you're at work, you get a 10-minute break after every 4 hours. Make sure you're wearing appropriate clothing. Make sure everything's covered up. May ask you to wear scrubs if needed. If you need an extra t-shirt, let us know. Make sure you're using appropriate language at work. No swearing, even if your clients do it. If your client is admitted to the hospital, we need to know about it right away. You cannot claim any time while they're in the hospital. Insurance companies will catch that, and it's fraud. We cannot take care of pets or do any outside chores. Make sure that you're always remaining confidential about your clients. Can be asked to do a drug test at any time. Make sure for your clients' safety that their walkways are always clear and cleaned up, especially if they have animals. Make sure their toys and food dishes are not in their walkways. Make sure you're not bringing your kids to work even if the client says it's okay. Make sure you're not on your cell phones while you're working except to clock in and clock out if needed. Make sure it's on silent if you have it on you. Make sure you're not touching their meds. If they fingerprint them, we could get in trouble. And then if you're working over 30 hours a week, remember that we do have benefits packages. We have 401k. We have a health insurance reimbursement program, disability, eye, dental. So if you have any of that, make sure you're using it. If you don't have that and you are working the 30 hours a week and are interested, please let us know. And then finally, you can now get paid to take care of spouses and minor children. So let us know if you or anybody would have questions about that. Now on to the packet. The Orientation to Home Care Quiz 2025. I'm just going to read through the questions and give you the answers. If you have any questions on anything that I go over, you can make a note of it and call us or email it to us, and I'd be happy to go over it with you. So number 1, employees must have a criminal background study with fingerprints prior to providing care. Is true. Each client is given a copy of the Bill of Rights. Is true. Agencies must have a system to receive, investigate, and resolve any complaints received. Is true. If you report suspected maltreatment and it turns out to not be true, you will be prosecuted. That's false. Each client should have an up-to-date care plan in their book, and that's true. And if they don't, make sure you let us know. We can get you a copy. Minnesota Home Care Bill of Rights quiz. Number 1, a person who receives home care services has the right to refuse services or treatments, and that's true. And that means if we go in to care for somebody today and they don't feel like getting out of their pajamas or they don't feel like taking a shower, that's fine. I would just document it on the back of your timesheet. Person who receives home care services has the right to complain about the services being provided to a person of their choosing. Is true. A provider must always protect and promote the rights of the clients. Is true. Person who receives home care services has the right to any information in their file. Is true. Person who receives home care services has the right to be treated with courtesy and respect. Is true. Number 6, a person who receives home care services has the right to receive care and service according to an up-to-date care plan. That's true. On page 2, under fraud, number 1, it is a felony to claim even 15 minutes that you did not work. Is true. Minnesota Home Care does not tolerate any fraudulent activity. Is true. Under boundaries, just be sure that you are maintaining healthy and positive boundaries and relationships with your clients. It's obviously different when you take care of friends or family members, but just try to remain as professional as possible. So number 1, it's important to maintain healthy boundaries with your clients. Is true. You should not talk about your personal life with your clients. Is true. You cannot exchange gifts with your clients. Is true. Under CPR, number 1, if you are not well trained, just do chest compressions at a rate of 100 to 120 beats per minute. Is true. Remember the acronym CAB, which stands for compressions, airway, and breathing, and that's true. Medication administration, the most important thing to know is Minnesota Home Care staff is not to touch, set up, or administer any medications for clients. If they already have it set up in a pill caddy, you can give them reminders and you can hand that to them as long as it's already set up, but we cannot touch their bottles and we cannot set up meds for them. No, so number 1 on page 3, medication should be set up by an RN or a family member. Is true. Direct support worker staff may pick up medications from the pharmacy with the client. Is true. DSWs cannot administer any injectable or IV medications, and that is true. Communicable disease. Most important thing with this is to be sure that you're washing your hands, make sure you're protecting yourself, staying away from people when they're sick or if you're sick, and that you let us know if you have any symptoms that would prevent you from working, such as fever, chills, cough, shortness of breath, any of that kind of stuff. So number 1 on page 4, washing your hands is not important if you're wearing gloves. It's false. Number 2, you should not go to work if you have a fever. Is true. Number 3, what is the most important thing you can do to prevent communicable disease is wash your hands or use hand sanitizer often. Number 4, it's good to stay current with your immunizations and flu shots. Is true. Number 5, call the office right away if you're sick so we can get you covered. Is true. And then under infection control, again, the best thing to remember is make sure you're washing your hands for at least 20 to 30 seconds or using hand sanitizer if you don't have access to soap and water. Make sure you're staying up to date with all of your immunizations and all of that good stuff. Wear a mask if you're sick. Wear gloves if you're going to come into contact with any bodily fluids at all. If you don't have gloves around, you can also use any plastic bags, anything to keep you from touching other people's body fluids. Make sure you're cleaning surfaces well. You can use Lysol or a 1 to 10 solution of bleach to make sure that you're sanitizing countertops, hand railings, light switches, that kind of stuff. If you have any extra time while you're at your clients' houses and there's not much to do for the rest of your shift, you can always be sanitizing, cleaning, wiping stuff down. So number 1 on page 5, employees must wear gloves when expected contact with blood or body fluids is true. 2, you should receive a flu shot each year if you are able is true. Number 3, examples of PPE include gowns, gloves, and masks is true. Number 4, the best way to protect yourself is to wash your hands often is true. Number 5, infections can be transmitted by air, blood, or by direct contact is true. Number 6, HIV is an example of a blood-borne pathogen is true. Number 7, either bleach or Lysol can be a good disinfectant is true. Hand washing, there is a video. Any sections that you see that says see video, there is a list of videos at the end of this that you can watch for further instruction as well. So number 1, wash your hands and wrists with warm water and soap is true. Number 2, you should wash your hands for at least 15 seconds is true. Number 3, you should turn the faucet off with a clean, dry paper towel is true. Tuberculosis. Number 1, TB affects the lungs and other organs is true. Number 2, latent TB means a person has been exposed but cannot spread the disease is true. Number 3, TB is treatable with 3 strong antibiotics for at least 6 months is true. On to page 6, caring for clients with HIV and AIDS. The most important thing to remember is to protect yourself, make sure you have good hand hygiene, that you're wearing gloves, things like that. So number 1, good hand hygiene is important when caring for clients with HIV is true. Number 2, you may need to wear gloves, gown, mask, and face shield is true. Number 3, HIV can be passed through body fluids is true. Teeth, gums, and oral prosthetic devices. Main thing with this is just to be sure that if your client has any red, tender, or swollen gums, anything that's out of the ordinary for them, bleeding when they floss or brush, anything that's causing them discomfort, that they should contact their dentist right away. So number 1, a regular oral hygiene routine is very important is true. Number 2, if the client is experiencing any mouth discomfort, they should contact their dentist right away is true. Page 7, under bed rails, just know it's important that if your client has bed rails, that you're trained on the zones of entrapment. So if your client has bed rails and you don't have that, let us know. We can get you a copy. There's also a video. So number 1, it's important to understand the zones of entrapment when your client has bed rails is true. Number 2, DSWs may only operate bed rails after they've been properly trained is true. Transfer belt. Number 1, apply the transfer belt over clothing and buckle in the front is true. Number 2, you should use an underhand grasp for better grip is true. Number 3, check female clients to be sure their breasts are not under the belt. And that's true. Page 8, temperature, pulse, and respirations. The main thing to remember with these next few is that Minnesota Home Care cannot check temperature, pulse, respiration, weight, any of that stuff for recording purposes. But if it's to help your client make a decision on whether they may need to go to the hospital that day or to see if they're not feeling well, that's okay. We just can't use it for any recording purposes. So number 1, Minnesota Home Care may not check temperature, pulse, and respirations is true. Temperature measurement with electronic thermometer. Number 1, follow the instructions for whatever type of thermometer you are using is true. Number 2, the thermometer will beep or show a readout when it's complete is true. Pulse and respirations. Number 1, have the client place their arm flat on a surface and relax their hand is true. Count the pulse for 1 full minute to obtain the pulse is true. Place 2 or 3 fingers on the palm and thumb side of the client's wrist is true. Blood pressure, the top of page 9, number 1, place the blood pressure cuff snugly on the upper arm is true. Inflate the cuff, then release the air to check the blood pressure is true. Weight measurement, number 1, be sure to weigh the client at the same time each day is true. Be sure to position the client on the scale correctly is true. Height measurement, number 1, client should have their feet flat on the floor when taking their height is true. The measuring rod should rest horizontally on the client's head is true. A height measurement when the client is unable to stand. So number 1, assist the client to lie flat on their back with their legs straight is true. And then mark the sheet at the top of their head and at their heel with a pencil and then measure is true. Fingernail care on page 10. Number 1, always ask the client if the water temp is comfortable is true. Always be careful not to cut the client's skin when clipping their nails is true. File any jagged edges on the client's nails is true. Foot care, number 1, apply soap and water and wash entire foot including between the toes is true. If the client is diabetic, we cannot do any nail care, and that is true. That should be done by a nurse. Partial bath, number 1, always ask the client if the water temp is comfortable is true. Ask and assist the client to participate in washing if they are able is true. Number 3, you should always wash and rinse all parts of the body is true. Tub bath or shower bath, number 1, encourage the client to assist as much as possible is true. If the client becomes weak, get them into a sitting position is true. Assist the client with washing and rinsing their entire body, and that's true. Make sure when you're giving any baths, partial baths, bed baths, a tub or shower bath, that you're always make sure you're keeping them covered so that they feel more comfortable if they have to wear a robe, or use a blanket and uncover each part of the body as you're washing them and then cover them back up. Helps keep them warm, helps keep them covered. Bed bath on page 11, number 1, keep the client covered with a bath blanket is true. Avoid force and overextension of limbs is true. Always maintain personal privacy and warmth is true. Always work from clean to dirty is true. Perineal care in a female, number 1, in perineal washing, go front to back is true. Number 2, observe the client for any skin irritation or breakdowns is true. And for a male, number 1, wash perineal area front to back it's true. That's always working clean to dirty. Number 2, be sure to always wear gloves while assisting the client is true. Okay, dressing the client on page 12, number 1, assist the client to remove soiled clothing is true. Put clothing on their affected side first is true. If their left arm is sore or their shoulder, it's going to be easier to get the shirt on that side, and then they can do whatever they need to do with their other arm to get it through. Range of motion, number 1, DSWs need to be trained to provide passive range of motion with their clients. That's true. Number 2, always check the care plan before you perform range of motion with your clients, and that's true. Transfer techniques on page 13, number 1, how do you know what transfer technique to use for a client? Consult the care plan. Number 2, always explain to the client what you're going to do before you begin the transfer is true. Do not use a mechanical transfer tool unless you are well trained, and that's true. And also nobody under the age of 18 can use them either. Walking with a walker, number 1, observe the client for dizziness before starting to walk is true. Walk beside the client holding the transfer belt with an underhand grasp is true. Wheelchair transfer, number 1, be sure the client's stronger side is closest to the wheelchair is true. Always check the client for dizziness and weakness before the transfer is true. Check the client for comfort once they are seated is true. On page 14, fall risk and prevention, number 1, mobility issues can lead to falls is true. Keep walkways free and clear from clutter is true. Always be sure that precautions are taken to avoid falls is true. Mechanical lift, number 1, you should be properly trained before using a lift is true. No employee under 18 is allowed to use a lift is true. Leave the sling in place under the client when the transfer is complete, and that's also true. Unless it makes them uncomfortable, then you should take it out. It just makes it so much easier to transfer them if they will allow you to leave it under them. Sideline position placement, number 1, all joints should be supported is true. Number 2, the bed must be locked in a flat position and elevated to a safe working height is true. Number 3, always check for proper body alignment is true. Supine position placement, number 1, always check the client for pressure areas, is true. Number 2, place the client on their back with their arms at their side, is true. Positioning, main thing to remember with positioning is to make sure you're checking your clients often for pressure points and areas of breakdown. Any reddened areas, anything like that should be reported to either the client or the responsible person so that they can keep an eye on it to make sure it doesn't turn into anything worse. You can use pillows or rolled up towels to help position them if needed. So number 1, pressure points are the most likely place for skin breakdowns, is true. 2, pillows are a great way to aid in repositioning, is true. A reddened area on the client is often a first sign of skin breakdown, is true. Clients must be repositioned at least every 2 hours or according to their care plan, is true. A reddened area on the body must be reported to the client or representative, is true. Moving up in bed, number 1, using proper mechanics, count to 3 and move the client up, is true. Number 2, slide your hand or your arm under their upper back and shoulders and another arm under their hip and buttocks to move them, is true. Instruct the client to push with their hands and feet on the count of 3 if they're able, is true. Okay, page 16, moving up in bed using a lift sheet. Number 1, ask the client to assist if they are able, is true. One hand should be at the client's shoulder level and one at the hip level, is true. Lift with the sheet rolled close to the client with an underhand grasp to hold the sheet, that's true. Occupied bed making, number 1, you need to wear gloves if linen is soiled, is true. Keep the client comfortable while making the bed, is true. Nutrition, the most important thing to remember is that you're encouraging your clients to have a well-balanced meal each day. Be sure they're drinking enough fluids, especially if it's hot. Make sure they have something next to them after you leave so that they're continuing to drink fluids, whether it's tea, juice, water, whatever they like. Number 1, staff should encourage well-balanced meals for the client, is true. Number 2, breakfast is a very important meal, is true. Number 3, some clients may have a special diet they need to follow, is true. 4, clients need plenty of fluids each day, such as 6 to 8 glasses of water, is true. Page 17, feeding a client. Number 1, sit the client up at least 45 to 90 degrees, is true. Encourage the client to self-feed if they are able, is true. Number 3, always check to make sure the client's mouth is empty before feeding more, is true. Number 4, offer the client sips of water throughout the meal if they can have it, is true. Heimlich maneuver on kids and adults. There are videos for these also, but the most important thing to remember is to make sure that you let the person know that you are going to help them. Get them into a standing position, position yourself behind the person, place your arms around their waist, make a fist and place it just above their belly button, thumb side in. Grab the fist with your other hand and push it inward and upward at the same time. Perform 5 of these abdominal thrusts. Repeat it until the object is expelled and the person can cough or breathe on their own. Once they can cough or breathe on their own, you can stop the Heimlich. And hopefully somebody can call 911 in the meantime. So number 1, if a person is choking, assess the situation and begin Heimlich if needed, is true. And over to page 18. Number 2, have a bystander call 911 if possible, is true. If the person is coughing, you can stop the Heimlich maneuver, is true. Bathroom and commode assistance. Number 1, ensure privacy but do not leave the client alone if they are unsteady, is true. Use gloves to assist to wipe, is true. Assist the client to wash their hands when they are done, is true. Emptying a urine drainage bag. Number 1, you should always wear gloves, is true. Number 2, measure the urine and empty the graduate, is true. Number 3, be sure to rinse the graduate with cold water, that's true. Dealing with Alzheimer's and dementia. Questions are on page 19. Number 1, there are 3 stages of Alzheimer's, is true. In late stages, they may need help with all daily tasks such as eating, is true. Number 3, clients may have delusions such as they need to go to work, which is true. Demonstrate ways to modify behavior in response to client behavior. The main thing with this is to know that it's the policy in Minnesota Home Care that employees are prohibited from using chemical restraints or mechanical restraints or manual restraints such as timeout, seclusion, or any other aversive or deprivation procedure. So we cannot use any of that. So number 1, always respect the client's personal space is true. Minnesota Home Care does not allow the use of manual restraints is true. For individualized strategies in the client's plan, follow individualized strategies in the client's plan to help them calm down is true. Number 4, call 911 if there is a risk for injury to the client or anyone else is true. Speak to the client in short, simple sentences is true. And if you're having any trouble with clients and their behaviors, let us know and we can try and help you come up with a better plan to tackle that. So behavior intervention, number 1, call 911 if the client's behavior is unsafe is true. Consistent redirection is usually effective is true. Verbal and visual cues are often more effective than just verbal cues is true. If the DSW is having trouble handling behaviors, they should be terminated. Obviously, if that's false, call us and we will help you. Safety is very important with behavior issues is true. Hearing loss, over on page 21, number 1, there are 3 types of hearing loss is true. Hearing aids may be a good option for someone who has moderate hearing loss is true. Hearing loss can affect speech and learning is true. Care plans, number 1, the care plan directs all cares is true. Servicing agreement and care plan will always match is true. Care plan quiz must be completed by the employee and returned to Minnesota Home Care is true. Care plan quiz can be found in each client's book is true. Care plans may need to be updated if there's a change in condition is true. Supervisor and the client's representative make sure the employee is following the care plan is true. Direct support worker responsibilities. Just going to go over a couple of these. Make sure that you are providing cares as listed in the care plan. Make sure you're remaining confidential at all times. Make sure you're filling out your time cards correctly and that you're clocking in and out if your client requires it. Make sure you're not on your cell phone while you're working. Number 1, your time card and what you punched in on EVV should always match is true. Employee schedules are determined based on what the employee wants to work. It's false. It should be on what the client needs. Page 22, number 3, DSWs must read and understand the care plan and provide cares according to the care plan is true. Clients or their representative must verify all hours worked is true. Employee may add hours to their time card they did not work for gas money, obviously false. Employees can take a 10-minute break after 4 hours of work is true. Employees should sit on their phones and text and call people while they're being paid to work. False. Emergency preparedness is the policy in Minnesota Home Care for each client to have an emergency or backup plan at the time they sign up with Minnesota Home Care. There's also other things they can do to prepare for emergencies, such as have extra food and water on hand, candles, matches, flashlights, batteries, all that good stuff. The more prepared for an emergency they are, the better chance they have to get through it. So number 1, each client must have a backup person in place in case of an emergency is true. There are ways to be prepared for emergencies, such as having an emergency kit, which is true. In the event of a severe storm, move yourself and the client to an interior room on the lowest level possible is true. Handling emergencies and using emergency services. Number 1, call 911 if you have a serious emergency is true. Time is critical in emergency. Act fast is true. Notify Minnesota Home Care if an emergency occurs is true. Fire prevention, over on page 23, number 1, always make sure that your escape routes are clear is true. Make sure all smoke detectors are in proper working order is true. If there is a fire, assist the client out of the building to a safe location is true. Handling home care complaints, number 1, there is a Minnesota Home Care complaint form in each client's book is true. Number 2, you can always call Minnesota Home Care with any concerns at any time is true. Child and passenger restraint systems, there's also videos for these, but the most important thing to remember is that if a child is 8 years of age or younger, they should be in the back seat or they should be in a booster seat or a car seat, whatever fits their age requirement. And if they're 13 or under, they should be in a back seat. So that goes through page 24, and then on 25 is the questions. Number 1, a child under the age of 8 years old should be in a safety seat, is true. All children under the age of 13 should be in the back seat, is true. Number 3, when using a rear-facing seat, you need to make sure the base of the seat is level, is true. And if you have a child that you take care of that needs to use a safety seat, you should be properly trained on that as well. So if you need anything for that, let us know. Cultural communications training, that takes us through page 27. And the main thing to remember is that everybody has their own unique identity, and the best thing you can do is sit down with your client and see what their likes and dislikes are and what's going to keep them comfortable in their own home. So number 1, federal and financial assistance may not restrict service or aid based on race, color, or national origin, is true. Our own beliefs should never affect how we provide care to others, is true. Each person's cultural identity is unique, is true. Effective communication is necessary to be culturally competent, is true. Vulnerable adults training, the main thing to remember with that is that vulnerable adults reports can be made to Mark 24/7, 365. If you ever need the phone number, email address, or need help filling out a report, you just let us know at Minnesota Home Care and we can help you with that. Page 29. Number 1, all employees in Minnesota Home Care are mandated reporters, is true. VA reports can be made to Mark 24/7, 365, is true. Neglect is the failure to provide food, clothing, shelter, medical care, and or supervision, is true. Maltreatment means abuse, neglect, or financial exploitation, is true. Person receiving CFSS services is a vulnerable adult, is true. Positive support strategies, again, sitting down with your client, finding out if they have any schedules or routines that they would like to stick to, finding out if they have any family members they would like to, better their relationships with, finding out how they like to manage stress and helping them with that. Maybe it's taking a walk or taking a bath, encouraging them to do those things. Just create an environment that is supportive to the person that you support. All of that takes us to page 32. Number 1, sit down with your client and talk about what is important to them, is true. Every client will have different goals, is true. 3, supporting our client's social and emotional well-being is important, is true. Number 4, stress can cause headaches, anxiety, and tension, is true. Number 5, a certain task may be easy for one person but hard for someone else, is true. Number 6, for some, simply taking a bath can reduce stress, is true. Nutrition goals can be a good conversation starter, is true. Number 8, find out if there is a specific schedule or routine your client would like to follow, is true. And there on page 32 is the list of videos. If you want to have any extra in-depth training, or if you have clients that deal with any of those things, you can certainly watch those. And then on the last page, page 33, be sure you sign and date the bottom. If you are doing it online, make sure you type your name in there. Click the box that says you understand that you're typing your name and verifies that you're e-signing the form. And then I'm just going to go over the concerns and change of status acknowledgement. So you acknowledge it's your responsibility to notify Minnesota Home Care immediately of any problems or concerns relating to the client, or if they're hospitalized. Make sure you let us know of any employment changes. We do require a 2-week written notice. Make sure you know that it's the policy of Minnesota Home Care. We can do random drug testing at any time. Make sure you read and understand the Bill of Rights and the home care complaint form that's in the client's book. You acknowledge you can't work more than 40 hours in a week for Minnesota Home Care unless previously approved. Acknowledge that I can only care for one client at a time unless shared care is offered for my client, and that overlapping hours is against the law unless approved by the state of Minnesota. Make sure you know that if you're found guilty of committing fraud, that your employment with Minnesota Home Care will be terminated and you will not be eligible for rehire. You'll also be responsible to pay back any wages that were paid out that were found to be fraudulent. Make sure you notify Minnesota Home Care immediately about any health concerns or declines in the health of your client. So you know it's your responsibility to make appointments and or transport clients to their appointments. Make sure you are documenting that on the back of your timesheet and also helping them keep track of their appointments on their calendar. I understand that if my client requires EVV, which is the electronic time cards, that you're clocking in and clocking out properly. Make sure you never borrow money to or from your client. And make sure you understand that it's your duty as a Minnesota Home Care employee to remain confidential about any information that has to do with the clients that you take care of as outlined by HIPAA rules and regulations. Again, thank you for attending the 2025 Minnesota Home Care in-service. If you have any questions or concerns, please call or email us or stop into the office right away. And we hope you have a great rest of your day. Thank you.